Number one, we're going to lose on public health. That means cigarettes are going to be they are going to be affordable, and that many people or young people can access them. That is where we are losing. Number two, we are losing on revenue. And as you're aware, the country, yesterday's headline on the Daily Nation, the cabinet secretary responsible for national treasury said we do not have money. So how do you pass an amendment that actually makes the government coffers to go down? So that's the next frontier. We're losing on revenue. Number three, the country is losing on actually our credibility. If you look at the amount of money that the Kenyan government has invested in sending its delegates to negotiating the WHO FCTC, particularly the guidelines, the Kenyan government was the number 2 country in the world to sign and ratify the FCTC in 2004 after Norway. So you ask yourself, in terms of credibility, what will we tell the world when we've been providing leadership in effective implementation of tobacco control policies, and now we are reversing, going back all the way to the year 2008. And then number 4, Article 2 of the Constitution, Section 5 and 6, clearly says international treaties and laws are part of the domestic law. So we therefore, by implication, the Tobacco Control Act 2007 is the domestication of the WHO FCTC Framework Convention on Tobacco Control. So this is a law that Section 12 requires the Cabinet Secretary to implement tax and price policies that reduce consumption. And to the credit of the Cabinet Secretary of the National Treasury, through the Excise Bill, as you see in the presentation, he actually did the same in June during the budget and the proposals in the Excise Bill. Then this was reversed in one afternoon last Thursday by the National Assembly. And therefore, that's why we say today, let us actually come and tell Kenyans what this means to Kenyans. If you can actually been seeing, the president has been very committed in fighting drug abuse, even his statement yesterday in Mombasa. So the question that we are therefore telling the president is, here is a perfect policy position that you can actually use to send a strong message to Kenyans, is that we cannot be fighting hard drugs when the two gatekeepers, that is alcohol and tobacco, nothing is being done about them. If you remember, a few weeks ago, the country embarked on a campaign to address the second generation, the alcohol that is destroying many people. And do you know, this excise bill, they actually have not done anything in addressing the second generation alcoholic drinks. Tobacco use and exposure to tobacco smoke is a major risk of a non-communicable disease. Kenya is a signatory to the World Health Organization Framework Convention on Tobacco Control, that is the WHO FCTC, which amongst other strategies proposes the use of price and tax measures as effective strategy for reducing consumption and prevalence of tobacco. Kenya ratified the FCTC in 2004 and domesticated it through the Tobacco Control Act of 2007. The Excise Duty Bill of 2015, which was proposed by the National Treasury, the bill proposed that tobacco and tobacco substitutes were to be taxed at Kenya shillings 2,500 per mil. On the 27th of August 2015, through the supplementary order paper, the Departmental Committee on Finance, Planning and Trade made amendments to the Excise Duty Bill 2015 during the committee stage. It outlined that there was need to delete the provision that the minister proposed, which was the proposes that the cigarettes containing tobacco or tobacco substitute be taxed at 2,500 per mil, and then introduce the structure whereby for the first time we reversed the gains we've made from 2012 and went back to pre-2007 scenario. The effects of these amendments, the adoption of this proposal by the National Assembly has huge negative ramifications both to public health and the fiscal objectives of the Kenyan government. It also goes against global best practices for tobacco tax administration as recommended by WHO and the guidelines for effective implementation of Article 6.
There is a case in court, but the industry knows that most of our attention is in court. So they are going around doing other things, and I cannot say that we are I cannot fail to say that we are suspecting somebody is working for the industry in Parliament. And this is very, very serious for us. I might be going too far, but this is the truth of the matter, that we must rise up and say no to what is happening. We cannot talk of eradicating alcoholism and drug abuse without addressing tobacco. Look at Central Kenya, where we say alcohol has really hit the men of that region. It is also the major consumer of tobacco. So you see, these two things go together. I've never seen a fellow who keeps on chewing miraa and doesn't smoke. So as we address drug abuse, alcoholism, we must seriously address tobacco, because as he has said, it is actually the gateway. Most of those who go into hard drugs and alcoholism are also smokers. We are praying that our parliamentarians come to their senses and think about this country. Because as we all know and as we all say, a healthy people is a wealthy nation. We cannot be a wealthy nation if we are sick. And the tobacco, as we have known, causes a lot of problems to us.